Hi, Bob Quinn here for Blue Poppy and Blue Poppy Continuing Education. Today I want to show in just a few minutes how I combine the work of three of my teachers, Dr. Hiroshi Nagata, MD, Takahiro Funamizu, acupuncturist, and Anryu Iwashina, acupuncturist. I combine their work in this region here, face, scalp, and neck, primarily here, the SCM scalenes area. And why do this? Not just for facial beauty. I actually don't advertise that sort of treatment at all. This is a wonderful part of treatment for anxiety, PTSD, insomnia, hypertension, chronic headaches, chronic sinusitis. Many conditions are improved by treating the face. So let's take a brief look at some point work we're going to do on the face. This comes from Dr. Nagata. So he has a lovely rhythm in how he treats the face. His own tool, I think I might have one in one of my pockets here, which is very different from the tools you'll see me use. He uses a more significant tool. And he holds it like a pencil. He stabilizes with his pinky and touches like this. So that's his way. I'll be using a Teishin. But the order of points is 1, 2, 3, 4, 5. So off the edge of the bone here, end of the eyebrow, middle, just above the middle, and the other end. And then come straight across the end, the middle, above the middle, the end, and off the bone here. Then he comes to, on the pupil line, 1, 2, 3, 1, 2, 3. Below the bone here, on the outer canthus, 1, 2. Over here, bladder, one area, 1, 2. Halfway down the nose, across the other side, kind of the large intestine 20 area. Large intestine 20, 1, 2, 3. Then this is sort of a little cleft in the bone, and over here off the corner of the jaw, and then the same points on this side. So he does it always in that order. As I say, it's a lovely flow, 1, 2, 3, 4, 5, 1, 2, 3, 4, 5, 1, 2, 3, 1, 2, 3, 1, 2, 1, 2. So you see he goes side to side where he can, and that's how we go through it. I do this generally before the stroking. The stroking is what comes from Mr. Funamizu, and it's more his first version. He's sort of updated his protocol. You could say this would be Funamizu 1.0, which I've stuck with. So we're stroking over towards the ear from under the nose. It still comes here, still comes towards the ear. Once you get up to the forehead, the stroking goes mostly just horizontally to the respective side. And then there's a combing through the hair. We'll show that with a close-up. And that the point work, I'm going to use the Teishin. The facial stroking work, I'll use this washing. And the work on the neck, downward stroking, I'll also use the Yama Enshin. These are all from the Gentle Spirit tool line available at Blue Poppy. So let's go ahead and see how this works. I'll be doing the SCM scalenes area first with both touch work and with the Enshin downward stroking. Then I'm going to move to the touch work on the face, and then the stroking on the face and the stroking through the scalp. And that will be it. You can do it probably realistically in under 5 minutes, easily in your treatments. So let's see what that looks like with the model now. As I mentioned, Dr. Nagata, he uses a tool like this. He anchors with his pinky, holds it like a pencil, and this is his touching technique, whether in the neck or on the face. I use a different technique. This I learned from Mr. Iwashina. We hold like this, where the tip of the Teishin is level with the tips of my two fingers, the index finger and the thumb. And this other hand will either this way create tension in the skin, pretend that the sheet here is the skin, and then on that line of tension we touch. So tension, touch, create tension, touch, create, touch. Or I can pull up to create tension, pull up towards the ear. So we take the head a little to the side, and this way exposing the SEM and scalenes area. And I fairly randomly go through there, creating tension, touch, and it's feather light. This is not so much a massage technique, more energetic than that. And if I find an area like here that's a little bit tighter, I can just repeatedly go around. If I want, I can even just wait there a little bit, a little longer before moving on. So in other words, it's not important that you absolutely keep the same rhythm. You can break the rhythm if you're on a very tight point like here and just wait a little longer. And then we use the Enshin, the round needle. These tools have been warmed up on the radiator, by the way, and we're just stroking down. In general, most modern people have too much energy coming up to their head, so downward is recommended. So again, I'm creating a little tension and then feather light this downward stroking. And if you want, you can even come under the clavicle. Remember, the scalenes comes under the clavicle to the first rib there. So under the clavicle, you can also do a little Teishin work and Enshin work. And then we come here, and I'm going to do on the other side that same thing. But I can already feel what a difference this made just to go through like that. And I'll admit, I was very skeptical when I first saw this sort of thing, because it looks like a lot of nothing, but actually it's quite effective. And I would take it this way. So again, I come in with holding this way. I hold this to keep the tool warm, and I'm using two fingers. Tension, touch, touch. Or I create tension this way. And it's always quite light. There's some tighter areas I'm spending more time on here. You can come back along a part of the occiput and around the mastoid bone, and then move to the round needle, the Enshin, E-N-S-H-I-N, Enshin. And again, these tools are available from Blue Poppy. These are the gentle spirit tools. This is our higher end line. We have another line called simply gentle tools at a lower price point. And so now we bring here. So why do we do the neck with a facial? If you release facial muscles, it helps release the neck. If you release the neck muscles, it helps the muscles of facial expression as well. There's sort of a reciprocal relationship. I was told by one friend who studied with one of the facial acupuncture experts in New York City, a Chinese woman, that she sees the neck work as being more than half of a good facial treatment. In other words, you need to treat here. So now we're going to go to the point work. I'll start here as I showed. So I'm going to be here. I'll count it out. 1 off the edge of the bone, 2 at the edge of the hair, 3 in the middle, 4 above, 5 here. And then that is repeated here. And once we are finished with that, then we come here, 1, 2, 3, 1, 2, 3, here under the bone, outer canthus, here under the bone, outer canthus, bladder 1, halfway down the nose, halfway, Li20, 2 points above, 1 below, then here, halfway out to the ear, at the corner of the jaw, halfway out in the corner of the jaw. And those be the point work. So let's see how that goes. Now this is a different technique. As I don't know if you can get this, as I touch, I press the needle out a little bit. So I'm coming down and then this happens. My fingers move in this way, expressing out the Teishin. So it is a little tiny pokiness to it. There is a tiny bit of that. So I come here, 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. 1, 2, 3. 1, 2, 3. 1, 2. Bladder 1. Bladder 1. Halfway down the nose. L.I. 20. Here under the nose, I pull back a little bit because it's a bit odd to be there. And then here, 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 here. That's the point work. Now we use this more spatulate tool, and we do the stroking, which comes from here over towards the tragus, Now they don't have to all be long strokes, but that's the general direction that we're moving in. So you see, I use these slightly shorter strokes, but the direction is over here towards the front of the ear. Now, this was all developed initially for the treatment of PTSD and insomnia after the tsunami, this facial work. And it works very well. I think it's all increasing the vagal tone. That's my own suspicion, because it turns out to be very important, very effective work. Now, of course, I mentioned other conditions beyond PTSD, insomnia, like chronic headaches, sinusitis. Now I'm up here, I'm not going down towards the ear, horizontally straight back. But I recently had a severe case of Bell's palsy, and it was amazing how much this worked. The person had gone for acupuncture on 3 successive days before coming to me, and with very little improvement. In the first treatment, her husband, it was interesting how it just blew his mind when she came out, his wife came out of the treatment room, and he just felt like it was near miraculous. So there's something very important about this work. And now you can come on the eyelid itself, but very lightly, feather light there. So there we have one side. Now I can feel the skin here and the skin here, a very different feel. This, we say, has much healthier luster. Come over here. Now I'm holding the tool so that when I stroke, it's not all like this, with the exception of when I'm under the nose. I want my skin of my finger and the tool both to make contact. That, Mr. Funamizu says, is a very important part of the technique. So here, just because it's odd to have my finger under the nose, I pull it back and use the tool alone. It's like that on the eyelid also, generally. But where possible, we have contact with fingers, the skin of the finger and the tool both. Notice my angle is very flat, the tool angled to the face. So here, you see feather light. This is wonderful, by the way, for broken blood vessels in the eye and on the eyelid. I've just been astonished with some patients how much difference just one treatment makes for that sort of thing. Some people think of this as taking liver heat out of the eye, by the way. And here in the yin-tang area, we can spend a little bit more time. Very calming. And people think of bladder 2, by the way, as a point to remove heat from the upper jowl, so we can also spend time there. In my experience, I haven't had any of my Chinese teachers talk much about bladder 2, other than you can needle it for back pain. But it's very commonly used in Japanese meridian therapy. Now I can use either this, or I can come back to the Enshin, the round needle. We're going to go through the hair. We head back towards Baihui. So there's a very flat, angled stroke, followed by the combing of my fingers. Now, as you're doing the scalp work, you can be perceptive, with say, energetically perceptive for something like something that feels other. Maybe it feels like xie-chi, X-I-E, xie-chi, or what Japanese say, jaki. Those would be areas you treat a little bit more, try to get that cleared out. And again, some people think of this as deficient heat that's coming up, that this is a technique that can vent that through the scalp. So we come back here, I'll just relax. So we had the neck part. We took the head to the side to do this here. We used the Teishin and the Enshin for that. And then we did the other side. Then we moved to doing the point work on the face. And then we moved to doing the stroking work on the face, and then the stroking work on the scalp. Now that's obviously on YouTube will be more than a 5-minute video, because I've had a talk as I work, and there's explaining the points at the board. But in my clinic, I do this on many, many patients. And I don't think it takes me more than 5 minutes. I think it's usually about 4 minutes to get through all of this. And it really contributes something. Now, what you've seen here is this is all I've done. I would never just start with a patient up at the head. As I said, most people have too much chi up there already. Better to work in the abdomen and the legs before then coming up here. Get some downward movement going from other parts of your treatment, and then come up here and work on the face, neck, scalp. So I hope this helps you. I hope this helps your patients. I thank you for your interest. Go check out at bluepoppy.com our newsletters. I have a regular blog. Check out our continuing ed courses at Blue Poppy Continuing Education. And again, thanks for your interest.